I see a lot of doctors, including myself, who were like, okay, you were low in this probiotic, take this probiotic. Or you have this overgrowing, let's get rid of it, let's kill it. Or you have this yeast overgrowing, let's get your immune system to basically keep it at bay. But we weren't thinking of this bigger picture of why and how are these things surviving? How are they fed? How does one's waste product lead to food for the other one, And it's just mind-blowing how little we actually do know even today. The fascinating thing, is that, wow, there's a probiotic that can lower your cholesterol, how fascinating that cardiologists should be, looking at the microbiome. Wow, the liver, internal medicine, there's things you can take if you have, for example, autoimmune encephalopathy. So if your liver basically is not functioning well and it affects your brain, they found that there's a probiotic strain you can take down the inflammation around the brain, and so it's just powerful. They really are powerful. I mean, these guys have been around way longer than we have. For us to think, or for me to think after 12 years of practice that somehow I'm smarter and more intelligent, it's just ego. These bugs have mutated and been around for so long. And they're smart. They're much smarter than we are. So really, I feel like we're always in awe and learning. But I often say it's not you that's bloated. It's the bacteria that gave off that gas. So they're not happy with what you ate, or there's a reason why that they gave off that hydrogen or methane gas or whatever gas it was. So basically, prebiotics is a fancy word for fiber. Prebiotic is the pre to the pro. So it's giving the bacteria food, and often the best source is fruits and vegetables. Another one might be some of the soluble and insoluble fibers that you can't get from fruits and vegetables, like psyllium husk, oat bran. But my favorites are just fruits and vegetables, and eating a lot of the skin, leaving the skin on, like oranges, for example, the bioflavonoids, leaving the rind on and not peeling everything, and making it all perfect. I would say don't eat too much. I think often we hear so much about macros and carbs and protein and fat, but I find intermittent fasting and sometimes taking a break and letting the gut just do its thing and detox and giving it a break to regenerate can actually be very beneficial. Sometimes I find we're snacking and we've been told to snack and have small meals all day. We never go into a truly fasting state, and I think fasting is very important for longevity and health. I think the top recommendation I will make to patients to help improve their microbiome is to eat a fermented food every single day. Not to take a probiotic necessarily, but to eat something that's different in color. So for example, having this morning I had pickled onions, which is more a purple color, right? Or having pickled beets, or sauerkraut, or kimchi, or kombucha, or even organic whole yogurt, which is fermented dairy, or kefir. So many different varieties of fermented foods that can really help increase diversity, and there's research backing that up. So that's my top list, and often they're delicious. People just don't know, like they just weren't trained. As a kid, we don't give pickled vegetables to kids, whereas in my culture, we always had pickled cucumbers. It's a pretty common thing to eat with your food, and often we eat yogurt with foods. Why is this person having this symptom? Why are they also having this other symptom? And this other symptom, how are they related? Could they be related in one individual? Absolutely, they have to be. You're one person. Everything you have, everything you're complaining of comes from you. Conventional medicine is really failing us at treating root causes of chronic disease. It's fantastic for emergency medicine. If you get hit by a car, please don't come see me. But it is really not doing a good job at picking up when someone's insulin is on the rise and saying, okay, maybe in 10 years you're going to become diabetic. But you know what? Your blood glucose levels look good. So just go home and do exactly what you're doing. Your diet has nothing to do with it, and they're being told this over and over again. And then it's almost too late. It's so hard to fix a problem when it's been there for 20 years. Just like personality, you know, for someone to change at age 50, it's pretty hard. You're stuck in your ways. And same with the body, the liver, the organs. When they're compromised, it's so much better if we could have prevented it to begin with. The gut sends everything to be processed to the liver, and then back to the gallbladder, and then back to the stomach. The pancreas gives the enzymes into the gut. So they're all linked together and they all communicate together. So the stool testing that I've done all these years have been just so informative. I can't imagine guessing and knowing if someone is digesting fat, if someone is digesting proteins, if they have viruses growing in their gut that I would have never known just based on symptom, and then if so, which ones. If they have yeast overgrowing, for example, is a pretty common one. And again, why? Not just going in there and killing the yeast, but why is it growing? If they have bacteria that is overgrowing, then in a normal human being, maybe this amount is normal, but if it's overgrowing, it could be problematic. And so a lot of these stool tests measure how much is in there. So Klebsiella, for example, or Citrobacter are two common ones that we see that can be problematic, but not necessarily. And this is where I say we're still learning. There are some doctors out there that see these and go straight to wiping them out. I tend to be a bit more on the other side where I pause and I say, okay, is this really the root cause of the issue? And sometimes we really don't know, sometimes it's trial and error, and it's looking at the research, looking at their symptoms, and seeing the whole picture. So what I like with the microbiome testing a lot of times, which is the one I use, is called Viome, which looks at not just what's in the stool, but just everything that you have. It's kind of like genetics. Okay, so you have this mutation. Does it mean it's active, it's turned on, or do I know if it's turned off? How do I know that? That's the epigenetics. So it's often not about what you have, but it's figuring out what are they doing, and who's talking to who's leading the other one to grow. And that's where we still don't know as much as we'd like to. And if someone's claiming that they do, we really don't. We're taught to be able to diagnose. And the diagnosis is not what's the cause of the constipation. It's make sure you rule out cancer, make sure you rule out this, rule out, rule out, rule out. It's often about ruling out. It's not so much about what is it. It's often, okay, well, it's not that, it's not that, it's not that, so it must be psych. Let's consult psych. It must be too much acid. It's not, let's look at the stool and actually see what's in the gut. The biggest things I see are patients who are on cholesterol-lowering medication. And if you actually look at the research, looking at a 10-year, 20-year, 30-year, 40-year decrease in having a stroke or a heart attack being on a statin, you'd actually be amazed at how many cardiologists or doctors actually don't know the stats. And if you look at the stats, it's amazing how misconstrued it is, even in the guidelines of cardiology, and how it's actually you're decreasing the risk maybe by 2.7%. But if you were to look at, well, why is that patient's cholesterol high? Is it that it's recirculating and being reabsorbed in the gut and not going out? Or is it that the liver is making too much, which a statin medication addresses? So it's amazing. It's just education. I don't think many of us are actually taught at what the root cause of the issue is. And so, of course, if I thought the cholesterol was the issue, which 50% of heart attacks and strokes happen with perfectly normal cholesterol levels, then of course my role would be to lower it or to get rid of it. But now we're finding, okay, it's the bystander possibly, and maybe there's endothelial issues going on that's dysfunctional, and that's coming there for a reason, and that's really not the issue. So statins being one of the sort of billion-dollar industry and one of the #1 drugs used, that makes a lot of money. Is it really saving lives? Is it really doing more harm than good? I don't know. It's a good question to ask. I would say the #1 thing I see on the rise is patients with heart disease. Younger patients dying earlier. I mean, the things I saw, for example, fatty liver. I always thought it's something that happens in older men, alcoholics. I just had a 35-year-old female, with fatty liver, and that's a big deal. That means your liver can no longer do its job like it used to, and the liver is so important for longevity, for how long you live. To go back to, how this affects your health, the microbiome, the microbes that live with you, I think the biggest thing I see is not just gut health. I think most people think the microbiome has to do with indigestion, bloating, gas, diarrhea, constipation. But to be honest, for me, it's actually more about the bigger organs that really affect your sort of longevity, which is your liver, your heart, or your brain. If someone has, for example, Hashimoto's, which I see a lot of in my practice, that's my probably number one specialty, is how many people have Hashimoto's and they don't even know it, which they may have had for 20 years and it was never tested. And even if it was tested, they may have not even been told, which is often the case too, is that's been there because there's no treatment for it. You just wait for the immune system to attack your thyroid as much as possible until we can replace the thyroid. There is no understanding of why is my immune system attacking itself in this location versus that organ. So often the treatments I use is based on really, really, really proper assessment. A lot of my assessment is using advanced testing, but really it's in a really good case taking. So taking 90 minutes to really look at someone from preconception until where they are today. So I go all the way back to before they were born and really, really take a thorough history. Often the things that went off first, so that could have been that they had heartburn at age 12, or that they had ulcers at 5, or that they started getting constipated or had diarrhea at age 7, and they're 50. But that's still important. Why was it that happened back then? What was the first system to go off and why? Sometimes that's very crucial in looking at the now. Often we don't care about what's happened in the past is done, but it can give you clues. Obesity and weight issues that I see commonly, it's not necessarily what they're eating and exercising that's actually contributing to their health problems. It's often what they have been eating. And so often what we find it's the sugar content, for example, that they had high in their diet, or the corn syrup, or the sugars which they didn't think were bad that were hidden in their foods, which, for example, fructose, and the corn syrups that we find now. That's what affected the microbiome and changed the diversity and affected their gut flora, which then changed their brain, their liver function. I mean, it can go everything from there, from just what they ate, consciously knowing that it was bad, or actually even not consciously knowing. A lot of these things that are banned now, trans fats, this sugar, that sugar, they're so hidden in different words and names. And it's just amazing how much sugar can actually change the microbiome and affect it negatively. So I would say if there's one thing I ask my patients to do that have obesity issues, or if I can help them with that, is really look at the sugar in their diet and the hidden sugars, the healthy sugars, the sugars that that brand bar, that cereal, the Fruit Loops that claims, to be healthy and full of fiber and full of protein, but it has sugars that actually are a disadvantage for the bacteria in the gut. So I think the obesity here is not necessarily, exercise does also affect the microbiome. So what you eat and how much you move does, but it also depends on, again, like I said, what your mom ate, what you ate as a child that's led to here. Sometimes I'll see a patient remove their gallbladder, or they had something drastic happen that can really change the microbiome, and that triggered the onset of weight gain, hormones change, menopause kicked in. But in a truly obese patient who's been obese for a while and really having a hard time with that, often it's the predispositions. It's almost like the terrain, the soil of that tree is bad, and you're trying to pick the leaves that are going bad and cut off the branch, but it's really, you got to go to the soil and see, okay, what is off right at the core, and often the core is the microbiome, is the gut, is the liver.
We know that the liver changes.
When we take out the stomach, we do gastric bypass, we actually take out the organ that is most crucial in living and giving us nutrients, which then puts more stress on the liver, and so it's just a bad downset to go.